One particular child asked me if Dr. Suter was going to use his safety scissors or his Jedi laser to fix his hernia.
Children have a lot of questions and fears before they go into surgery. Child life advocates at INOVA Fairfax Hospital are on hand to ease those worries.
Our involvement in procedures is really important in helping kids understand what's going to happen. A lot of it is helping decrease that anxiety by explaining things step by step and demystifying things in their head.
Child life advocate Katie Donovan visits with each child in the pre-op area before they're taken into the operating room.
My first initial thought is to build rapport with them and gain trust.
This morning, Katie is making friends with 8-year-old patient Caesar.
You kind of look like SpongeBob.
Playing with them, I can kind of assess their development.
Are you an Angry Birds guy?
Yeah.
Yeah. Have you ever played the Where's My Water game?
Yes.
I can find out about their past experiences in the hospital.
Is this your first time coming here to the hospital, or have you been here before?
This is the first time.
First time? Okay, gotcha.
I can kind of get an assessment of how is this family going to need to be supported.
Child life advocates have a number of ways to get kids comfortable before they go into surgery, like having them use iPads.
I have preparation pictures. This is a lot to take in when you walk into a place. So having them identify child-friendly objects that they're already familiar with, like a bed, there's computers, there's a green balloon, there's a chair where mom or dad is going to sit, and kind of letting them know what the sequence of events and the sensory experiences are going to be.
Do you know what these are?
No.
No, what do they look like?
It's like satellites.
Like satellites, yeah. They're actually lights at the top of the room.
The worst thing you can do is say nothing, walk back, the kid's looking around going, this is a strange place, I don't like this, and do that kind of stuff. The worst thing you can do is take a 5 or 6-year-old, tell them nothing, take them back to a room and put a mask on their face.
Anesthesia is harder to describe through photos than the operating room, and many children don't understand the concept of going to sleep with medicine. The unknown can be scary.
Sometimes it's the mask that scares them, or sometimes, you know, if I can talk with them and identify what it is that's making them worry, then I can address it.
I think the biggest question that I get is, am I going to wake up in the middle of surgery? And it's a totally understandable question. I would think the same thing before I went into surgery. How do you really know I'm not going to wake up?
I'm here to make sure that that doesn't happen, actually. I know you're breathing, and I know you're going to wake up at the end, so the whole time I like to make sure that everything's going perfectly. On some level, you want to kind of view yourself as the little angel that watches over them. You know, you're like, I'm here for that, the guardian angel.
In order to make kids feel more comfortable with the idea of going to sleep, child life advocates and pediatric anesthesiologists describe the process visually.
You know, I said, do you like balloons? You know, oh yeah, I like balloons. Well, I have a sad balloon in the other room. It's flat. You know, I've got their attention a little bit. Even if they're looking at the iPad and I have a sad balloon, okay. So what are we gonna do? Well, it's your job, you gotta blow it up today. All right, so here, you know how we do this? Do you like masks?
Breathe in the mask until you fall asleep. So there's no pokes or needles or anything like that. Do you know how to blow out birthday candles?
Yeah.
How do you do that?
I blow.
You just go.
And the balloon gets bigger and bigger and bigger.
The visual imagery provided in pre-op is helpful for Caesar when he's rolled into the OR.
Does this room kind of look like that picture we saw? Yeah. You see the green balloon anywhere?
Right there.
Mm-hmm, exactly right. I'll hold this for you so you can hold your mask if you want to.
Are you holding the mask? They're going to smell a stinky gas. So instead of saying you're going to smell a stinky gas, which kids are like, what is a gas? I say, we're going to take a walk through the zoo and smell a bunch of stinky animals, and we're going to smell the hippopotamus, we're going to smell, you know, the giraffe and the elephant and the monkeys.
Doctors, nurses, and advocates can help children understand the process, but it works best when parents explain to their kids in advance why they're in the hospital.
Sometimes kids walk through the doors thinking that they're here to go to see a movie or they're here to go to the beach, and that's a particular situation where we kind of have to address with the parents, you know, this is why it's important to be honest with your child about what to expect. And we don't have to talk about cutting, we don't have to talk about incisions, but we can talk about openings and band-aids and fixing things and kind of giving it softer language to help them understand.
3-year-old AJ's parents did just that to prepare him for his surgery day.
Every day we're reminding him that what he was gonna be doing and that he was gonna get, because he had an umbilical hernia surgery, just letting him know, that he was gonna get the thing on his finger and he was gonna be put to sleep.
AJ was so comfortable with going into surgery, he didn't need much attention from Child Life.
Should we turn left or right?
Katie says the fact that every child is different is one of the best aspects of her job.
Every child gives me a new challenge, and every family reassures me that they're glad that I'm here and that this was a service they weren't expecting to have.
In Falls Church, Virginia, I'm Ashley Iaconetti, NCC News.